Welcome, Tanya. I just want to welcome you to this lesson for today. It's just going to be a short lesson, so won't take too much of your time. What we want to talk about today is hand hygiene. I still remember you from the previous lessons that we've had, the compulsory reporting. I don't know whether you still remember me.
Yes, I do.
You do. Okay. Yeah, like I said before, my name is Renee. I'm a registered nurse. I'm also a workplace trainer and assessor. So I've been asked by your facility to train you guys, so please don't be surprised that I'm training only you this time. That's the requirement for the day, train one person at a time so that we get this right. Because hand hygiene is a really important factor in terms of stopping the transmission of infection from the staff to the residents in our care. So this is just going to be a short lesson, like I said. So if you want to go to the toilet, our toilets are located to the back here. You go that way, and that's where you find our bathroom facilities. In case of an emergency, that's the way you go. You go towards my left, you go straight towards that way. So that's where we meet for our fire evacuation. And should you hurt yourself during the course of this training, or should you need any first aid attendance, you go straight the same way. You'll find our first aid officer there. All right. So maybe just for the sake of our video, do you want to introduce yourself to us?
My name is Tanya, and I work in Bethany Waters.
Okay. All right. So how long have you worked at Bethany Waters?
For 2 years.
2 years. Okay. So what's your role there?
I'm a registered nurse.
You registered nurse. Oh, that is good. That is good. So we're talking to somebody here that really knows much about infection. That knows the importance of not spreading infection. From yourself, rather, let me say, from one person to the next. You already know what we're talking about today. All right. So there is a few things that I would like to give to you here before our lesson commences. So this is our pamphlet there. That's what we'll be concentrating on. So really my teaching will come from that. It's just written in point form, but I'll continue to elaborate as we go. This is our feedback form. Don't worry about filling that one in. You fill that one in at the end, of the training session. And then here, got a learning plan here that I would like you to sign off at the end, right? So the second page there, you sign off there, but don't worry about that one. So the two of them, the feedback form and that workplace thingy, don't worry about them. We sign them at the end of this whole thing, right? So we have our pamphlets there. Just take a look there. This is what we're going to practice at the end. It talks really about how to use our hand rub. And we've got our hand rub here, which is going to be our main focus when we get to the practical session. Like I said, this is not going to be a very long session. It's just going to be a short session. So just remember to fill in that attendance form, because we want a record that you actually attended the training, and also complete the feedback form there. So when you complete the feedback form, I'll just want to remind you again at the end that you tick the boxes, but also make sure you write something under the comments as well. Okay, so maybe what we want to do today is just talk about hand hygiene. What do you understand when you hear the term hand hygiene?
I understand that if you don't use that, you could affect someone else with your germs.
Okay, all right. So what would you describe hand hygiene as being? What do you need to do for us to say you've achieved hand hygiene?
Washing your hands before you eat.
Okay. Yeah. So the traditional way of hand hygiene has always been washing your hands with soap and water. But through research, all the research that goes on, in nursing, research is forever happening, because we want to develop and find out why infection is spreading, how we can reduce the numbers of infections. So they have come up with different kinds of hand gel. This is the one that we have today. I'm sure that's the same one that your company will be using, because that one is from Johnson & Johnson. There's different kinds of hand gel that you come across in different places, So that's what we're going to be focusing on. So on my pamphlet there, I have it written, in a healthcare setting, acquired infections are responsible for the death of most of the people, whether it's patients or whether you decide to call them residents. Hand hygiene is responsible for that. And the hands of healthcare workers are the main pathway of spreading infection, right? So today what we want to talk about is hand hygiene. And the reason why I've said it is hand hygiene is specifically to cover, we don't want to say hand washing, because the minute we say hand washing, we're talking about washing our hands with soap and water. But the reason why we're saying hand hygiene today is so that it also encompasses this, the use of the hand gel, all right? So hand hygiene is important because it reduces the risk of infection. It reduces the spread of infection. And thus, at the end of the day, you protect yourself, you protect your fellow workers, you protect the residents. Really, because infection can be spread from you to the resident, or from you to this resident to the next, or from the resident to yourself. So by hand hygiene, you eliminate that factor. You eliminate the spread of infection. So maybe let's just revisit our learning outcomes today and find out what it is that we want to achieve by the end of this learning session. Okay. So at the end of this learning session, the first outcome is I would like to assist you as a participant today to understand what hand hygiene is and its importance. I think we've covered that one already, right? And I would like to assist you with the knowledge of when to perform hand hygiene. I'd like for you to understand when you actually perform hand hygiene. And I would like you to identify the two methods of hand hygiene. I'd like you to be able to do that by the end of this lesson. And I would like for you to be able to demonstrate how to use this hand gel at the end of the lesson. Okay. Some places call it a hand gel, some places call it an alcohol-based rub, but it's all the same. At the end of the day, it kills bacteria without water. All right. So maybe to cover our second learning outcome there, when do you think a person should perform hand hygiene? According to your own understanding, let me talk about a hospital setting or a nursing home setting. When do you think someone should perform hand hygiene?
Before giving the patient food or performing surgery.
Okay, yes. Mm-hmm. Anything else?
Not really.
Yeah. Anything else on the handout that you want to read a little bit there? Mm-hmm.
After visiting the toilet.
Yeah, that's another important one. Yeah. So I've got it written down there that we wash our hands before and after eating, which is really important. Before you put food in your mouth, we usually have these gastro outbreaks, and if you don't wash your hands, you actually transfer those germs from wherever you're getting them into your body through ingestion, right? So the next one is, I found this quite funny, as I was doing my research, it says before and after visiting the toilet. The reason why it was so funny for me is because we normally wash our hands after visiting the toilet, but there you go. It looks like we also have to wash our hands before visiting the toilet. And the next one there is after sneezing or coughing. You know how some bugs can be spread through droplet infection. You sneeze onto your hands, you sneeze onto your hands. So as a result, your hands are germ carriers from that point onwards. You're carrying germs there, and when you walk around, you touch other people, you touch things, you're spreading the germs to them. So if you actually have a chest infection or you have a cold, you have that capability now to spread the infection to the next person. So it is important to wash your hands or to perform hand hygiene after sneezing or coughing. After handling dirty linen, you understand that one? Yes, because we're forever changing they pass urine on themselves, they open their bowels on themselves. So as you change them, you're in contact with their body fluids. And when you're in contact with their body fluids, you never know what's brewing in there. They could be coming up with a gastro, whatever kind of infection it could be there. And whatever, there could be blood on their linen. So after touching or handling their dirty linen or clothes, it is very necessary to wash your hands before you move on to the next person, right? So also again, we're speaking about before and after performing a procedure. Like you rightfully said, after surgery, that is really important. Some residents may need to have a wound dressing done, if they injure themselves and the dressing needs to be performed. You will need to wash your hands before and wash your hands after. If you're going to insert a catheter as well, then you need to wash your hands before, perform hand hygiene before and perform hand hygiene after to prevent transmission of infection from the last person that you touched to this one and from this one to the next person. And you also don't want to be taking the germs home as well. After touching resident surroundings, you find that some residents sneeze on their surroundings, like we were rightfully saying there, that once you have those germs on your hands, if you touch around, you tend to spread the germs there. So as you're touching around their surroundings, you never know, maybe another fellow member would have touched the area, their residence environment with foul hands that are contaminated with feces, hands that are contaminated with urine, hands that are contaminated with blood. So after touching their surroundings, before you actually move into the next room or to the next residence, you need to perform hand hygiene. Does that sound interesting so far? Okay. Yeah, and like I said there, after exposure to body fluids. So body fluids really are spit, if there's spit or cough up, if there's blood, if there's feces, if there's urine, you need to perform, if you're exposed to those things, you have to perform hand hygiene. Right. And the interesting thing about using this gel is you only use it when your hands are not visibly soiled. So if you have blood, the actual blood in your hands, you're better off washing your hands with water and soap. If you have feces in your hands, you're better off washing your hands with water and soap. If you have the urine or pus or whatever it is, in terms of body fluids in your hands, you're better off washing it off with water and soap, right? So this hand gel is really designed for when your hands are not visibly soiled. You've touched there, or you've done that, or you've done that. When you look at your hands, they are not visibly soiled. You can, safely use that and really know that the germs have been eradicated to a certain extent. So what are the benefits of using alcohol-based rubs? I don't expect you to know much about this one, so I'm not really going to ask lots of questions. But these alcohol gels are dermatologically tested. So the dermatologists actually test them to ensure that they are gentle on hands. They won't dry your hands. They are very, very mild on your hands. They won't cause irritation. There are some people that they've got different allergies. So these have been dermatologically tested to exclude all that. Okay. So that's the one advantage about them. That's one of the benefits about using an alcohol-based rub or an antimicrobial hand gel. So they also require less time. Imagine if you were to move from this resident to that and your sink is, down that way, it means that when you attend to this resident, you run to the sink, you come back, you attend to this resident, run to the sink, you attend to this resident, run to the sink. You keep going that way, you keep running back and forwards to the sink. That does tend to take a lot of time. But if you're going around with your linen trolley or your skip or whatever it is that you'll be pushing, or it's a wound trolley or your medication trolley, like you said, you're a registered nurse, you're better off with this hand gel. It doesn't take much of your time, because what you simply do is sweat it in your hands, clean your hands like I will show you, and that's all you need to do. So you're no longer walking up and down to the sink. I guess this is why people don't perform hand hygiene often enough, because it's a time waster. You know, maybe you've got 5 minutes to finish all these things, but if you have to keep running to the sink, trying to locate the sink, then that takes a bit of your time. The other one thing about them is that they are cost effective. You know, if it's water, then you're being charged for the water bill. You're going to be charged for the towel that you're going to use. If it's a facility that uses those flannel towels, then you will be charged for that. If it's a facility that uses the paper towels, then that's money as well. That is money. If there is soap, I mean, if you're going to wash your hands with soap, that is money involved. But if you use this, then it is cost effective because it's just one thing and that's it. There is no different charges. There is no water. There is no flannels or paper towels or soap involved. You're just using that one, and that's it. It is easily accessible. You remember how I was just giving you an example there of if there is a sink over there. If you don't even know about the sink, what you might do is walk around and around looking for the sink. But this will be on your trolley with you all the time, right? All you need to do is carry it around. I've actually seen mothers in trains, you know, they've got those small ones. They just put them in their bags there after changing the baby's nappy, wherever they are, whether in the car, wherever they are. They just square it onto their hands and clean their hands. So there, it's easily accessible for them. So it's more effective in reducing the amount of germs on your hands. You know, like I said, research does say that this kills more germs than the actual washing of hands with soap and water. You know, the disadvantage, yes, washing your hands with soap and water is good, but the problem is that washing your hands with soap and water dries up your hands. You know, for some people, once your hands are dry, they start to crack. Once they're dry, they start to crack, and then infection goes in there. But this doesn't dry up your hands, right? It doesn't dry up your hands, and you find that when you use this and you go under a tester, actually this has been tested in the places where it's designed. You put your hands under the tester. The one that has washed their hands with soap and water, in comparison to somebody that has used an alcohol-based gel, this is more effective because it's an antimicrobial. It kills germs, you know. It contains a certain amount. This one actually contains 61.5% of ethanol, which also helps in killing germs. And the one thing that I forgot to say, you know, where I mentioned about the fact that it doesn't cause skin irritation, it actually contains a moisturizer. So I've seen in some facilities when you walk around, you wash your hands in the sink, you're looking around for a cream or some kind of moisturizer to apply to your hands, you find there is none. But this actually washes your hands and moisturizes them. So that is how it manages to prevent the dryness of the hands or the irritation of the hands. And like I said before, the last point there is if your hands are visibly soiled, you're better off washing them with soap and water. Right. Is that clearly understood so far?
Yes, it is.
Do you have any questions so far?
No.
Okay. Yeah. So maybe from this point onwards, I'd like for us to go through how to use this hand gel effectively, because it's not just about putting it and rubbing it quickly onto your hands and you go. There's actually a technique that you use. I'm very short. I'm just saying technique, but you know, it's all about making sure your hands are fully covered with the gel, you know, so that all the germs that are covering your hands are actually killed, right? So I might just stand up here for a bit. Maybe while we're talking about that one, you would like to look at the how to hand wrap pamphlets that I brought with me. So basically, you know, once the seal is broken, like any other, you know, the cream and everything, once you turn it around and the seal is broken, it's ready for use already, okay? So I'll show you, I'll demonstrate 2 times, and then I'll ask you to show me, you know, 2 times as well. Basically, we're following that form, and that's how we're going to do it. So you're squirting, oh my goodness. Yep, you're squirting it into your hands, right? Palm to palm, right? Web of the fingers, back of the hands, web of the fingers, turn around, web of the fingers, right? You turn around and you focus on the tips of the fingers, they're rubbing them against each other, right? You focus on the thumb, Focus on the other thumb. And then you come and rub the tips of the other 4 fingers onto your palm. Do the same for the other hand. So you don't even need to wipe it off, because by the time you finish, your hands are dry. And that is the required amount of time. If you read there, it says that you need about 20 to 30 seconds of this procedure for your hands to be classified as being clean at the end of the whole thing. Alright? So I've seen some people going like this, trying to air dry them. You don't need to air dry them. Just by rubbing like that and trying to cover every aspect of your hand and every aspect of your what you call your fingers, you would have achieved a good job. So I'll try it one more time. So you squirt it into your hands, right? You rub it palm to palm. So really, it's not a difficult procedure. It's just making sure your hands are covered. All the parts of your hands are covered. You come this way, right? Now you concentrate on the fingers, concentrate on the thumb, concentrate on the thumb. Rub your fingertips to your, what you call, to the palm of your hand. Rub your fingertips to the palm of your hand. By the time you finish, your hands are dry. You know, the one thing that I like about this gel is that it smells good. It smells good. You know, give it a try. You just give it a try and see how you go. Just basically follow that. I mean, sometimes you may not always remember, but what I've arranged with your facility manager is to have these pamphlets at each station. So you have an option of washing your hands or using the hand rub, you know, in different stations. And this pamphlet will be stuck onto the wall to remind people on how to use that hand rub. But, you know, by the end of the week, you know, you really should remember that it's all about covering every aspect of your hand. So if you don't have that pamphlet to remember from, that is if, let me say, you are doing your medication round and the pamphlet is not there. The trick is just to remember that every part of your hand is covered with the gel for it to effectively kill germs. Do you want to give it a try? So square it into your hands, palm to palm. Yeah, that's good. Web of the fingers. Yeah. Try the second hand. That is good. All right. Try finger to, you know, the fingers. Yeah, that's good. Try the thumbs. One thumb and the next. And then try fingertips to palm. Try the next hand. How does that feel? Smells good, doesn't it? And by the end of it all, your hands are clean. Do you want to try one more time? See it so that we understand that we're on the same page. So my pamphlet there is actually saying apply 1 pump of the hand rub onto cupped hands. Yeah. Okay. Yes. Web to web. Tie your fingers like that. And then we move on to the thumb. Maybe for the benefit of the video, I know you don't want us to see your face. For the benefit of the video, maybe just move your hands so that the video sees what, yeah. Maybe we'll try again so that the video records you. Squirt onto your hands, palm to palm. That is good. And then web of the fingers. Web of the fingers. That is good. Right. And then, yeah. Thumb to thumb, thumb to thumb, tip of the fingers to the palm, tip of the fingers to the palm, and by the time you finish, it is dry. Alright, so I've got it written there. It's basically the same thing. Apply 1 pump onto cupped hands, rub 1 palm against the other, rub the back of the hands, rub in between fingers and back of fingers, rub around thumbs, rub tips of fingers on palms. And it says this procedure needs to take about 30 minutes. And once hands are dry, they are clean. So you don't need to air dry them or anything like that. You know, once they are dry, then we know that the hands are clean. All right. So I think now we'll just continue with our lesson and knowing our hands are clean at this moment, right? So maybe what we can do is just revisit our learning outcomes and hopefully see that we have achieved everything that we're supposed to achieve. So the first learning outcome was to assist you to understand what hand hygiene is and its importance. So do you understand? Do you want to just recap with me? Tell me what hand hygiene is.
Hand hygiene is when you're using a hand gel or washing your hands before and after eating or the procedure.
That is good, yes. So why is it important, would you say?
It's important because if you don't do the steps properly, you could spread germs either from people in the residence to another resident or people in your family.
Yes, that is so good. Because as nurses, we generally tend to take the germs to our families, really. And once we use the hands, we get into the habit of washing our hands before the end of the shift and using the hand hygiene, then we're safe and dry, really. So the next outcome was to assist you with the knowledge of when to perform hand hygiene. I think you've covered some of them there. Do you want to just recap on when to perform hand hygiene?
Before and after eating. Before and after using the toilet.
Okay.
After doing a procedure.
Yeah. For example, inserting a catheter.
Yes.
Yeah.
And
touching linen, handling linen. Yeah.
Yes.
Yeah.
And after, before and after you go on touching other things.
Resident surroundings. Yes. Yeah. That is good. So the third one was to identify the two methods of hand hygiene. Right. So do you want to identify what they are?
Washing your hands with soap and water.
Okay, that is
good.
good.
Using the hand gel.
The hand gel, yeah. Like I said, some places call it the hand gel, some places call it the alcohol-based gel. Whatever it's called, it will achieve the same purpose there. All right. So the last one was to demonstrate how to use the alcohol-based rub. Do you want to just try one more time with me so that we really get an understanding, rather not an understanding, but see that you have an understanding of how to use it. Okay. So just explain the procedure to me as you go.
You put it in your hands, then you rub palm to palm.
Yeah.
Then the back of your arm,
Yeah.
in between your fingers.
That is good.
And on the other hand too.
Yeah.
Then you put your fingers like this.
Together.
And rub, cup them, yes. And then do your thumbs. And both thumbs.
That is good.
Then rub your fingertips onto your palm on both hands.
Okay.
And then your hands will be dry by the time you finish.
And when they are dry, what does that mean?
That means that you have properly
Cleaned your hands. Yeah, I think that is really good. And I think, yeah, that is what I wanted for us to cover, I think maybe for the next lesson, I think what we should really schedule for is to talk about infection, the different kinds of infection, and how we can help in this industry on how to stop them from, once the residents are infected, we want to talk about what can be done if they are already infected. Because here we were talking about how to stop the infection from spreading. So on our next lesson, we'll be focusing on what to do after they've already been infected, right? So I just want to remind you again to complete the feedback form. Just make sure that you not only tick the boxes. So it's up to you. Tick wherever you want. Whether you strongly agree or you disagree or strongly disagree with any of these statements. And then you put comments. You need to put comments there. And then I'll need for you to sign off there, where it says learner. You put your name, your signature, and the date. Okay. So how do you think the lesson went? Do you feel like you benefited something from this?
Yes.
Yes, I think I benefited something as well. My hands are clean. I cleaned them so many times. Yeah, I think we've come to the end of the lesson. Is there anything else that you would like to ask?
No.
You don't have any questions? All right. So as soon as you complete that paperwork, I'll be able to take everything back to your manager, and then I'll move on to the next person. Okay. Thank you so much for your time. I really, really appreciate that. Have a good day.
You too.
Thank you.
Where is it?